snoring, sleep apnea, clenching, grinding, TMJ and face pain, headaches, asthma, tongue tie, thumb sucking. Chances are you suffer from one or more of these conditions, and I'm positive that it impacts the full potential of your life. Welcome to Myofunctional Pathways, the podcast, where we'll delve into all topics related to airway and myofunctional therapy. We help people find relief to problems that other treatments may not have helped with. Join us as we explore the ever-growing world of myofunctional therapy. We have one goal in mind, helping you to live your best life. We help you sleep and breathe deep. And now for the fine print. The information presented in this podcast is for educational purposes only and should not be taken as medical advice. We recommend consulting with a qualified healthcare professional for any questions or concerns you may have regarding your specific health condition. Hello. Today, let's talk a bit about how we plan a myofunctional therapy program for your child. So typically, I start working with patients once they're 4 years old or older. And the program and the way I design the program is going to be different for every single person, whether you're 4 or you're 90, all right? What really determines how I work with your child is what their abilities are. So in order for myofunctional therapy to be successful for a child or an adult, they have to be able to do the motions that I ask them to do. They have to be able to have a little bit of volition and intention to do the movements, right? And a lot of that is determined when you come in for your initial appointment and we do the evaluation. The functional evaluation gives me a good idea of how your child is going to respond to therapy. Again, we're looking at coordination. We're looking at how are their muscles moving? How are they not moving? How are things coordinating? Is there endurance? Is there tone? Is there strength? But also, what's the temperament like, right? So we have to make sure that the child is going to be able to engage in the process. The really nice part, though, is that even for an adult, I ask you to do maybe 5 or 6 minutes worth of exercises twice a day. So maybe in the morning you do 5 minutes of activities or 6 minutes of activities, and then the same thing in the evening. So that's the nice part about it, though, is that it's not a huge chunk of time. We're not saying, hey, every morning I want you to do this for a half an hour, and then you got to do it again at night. So sometimes people ask, well, how is 5 minutes twice a day enough to get enough strength in the muscles? And the thing you have to think about is, how are these muscles put together? They're different than your skeletal muscles. So when I say skeletal muscles, I'm talking about like your bicep or your tricep, right? They're different kinds of muscles. And when you think about your bicep, it has an origin and an insertion point. So what does that mean? It means it originates or it starts at one location, typically on a bone through a tendon or ligament, and then it inserts and connects to another bone. Your bicep has one job, okay? The difference with your facial muscles is that they are all connected and intertwined and interdigitated with each other. And that's why we can make all these different facial movements and all these different facial expressions, because it's not just one muscle that attaches here and inserts here. They do have insertion points and origin points, but they also, sometimes those insertion points are with other muscles. So that's a way of saying that they're all connected, okay? And when all these muscles work together, we're able to make different facial expressions, and we're able to do all these different things with our tongue and our mouth and our face. that our other muscles of our body cannot do. But at the same time, each muscle has its own job, or it makes its own contribution with a specific movement to what the goal is that you're trying to achieve. So if I'm doing the evaluation for a 4-year-old or a 5-year-old or a 6-year-old even, and they're really unable to do certain things, or maybe they just are not at the point where they can concentrate enough to be able to do these little blocks of exercises throughout the day, sometimes it's nice to start with like a smaller program or a mini myo program, where this might look like maybe 6 visits, and we work specifically on gaining some movement, because until you have movement, you can't really advance to other things. We need to have movement and coordination. We need to build up some strength and some tone as well before we can really dive into the functional part, which is being able to have a correct oral swallow and chewing and correct movements of the tongue and the muscles when we're doing things like chewing food and getting the food ready in our mouth for our tongue to propel it back so we can do that first phase of swallowing. So we have to have movement first. So sometimes, depending on the child's age and their ability, we might do a half of a program or a mini myo program. All right. If this child is very organized and they are able to do everything I asked, then absolutely, we're going to move forward with a full program, because I have every confidence that they're going to be able to meet the goals that are made for them, okay, at the end of the program. So a lot of it comes down to age and ability, all right? A lot of things that parents reach out about also is, my child is 8 or 9 years old and they're still sucking their thumb, or they're sucking on their fingers or a pen or the collar of their shirt or their hair, or they're biting their nails like crazy. So there's some kind of oral habit, a non-nutritive habit involving their mouth and some sort of object, okay? Pacifier too. Even some older kids even still use a pacifier as a way to help soothe themselves. So another thing that we help kids with is habit elimination. Let me backtrack a minute. This isn't just kids, because there's adults that still suck on their thumbs or their fingers, and they bite their nails excessively, and there's absolutely no shame in that, okay? There are adults that come and say, I've been doing this since I was a kid, and I just can't I can't get my thumb out of my mouth. Can you help me? Yes, I absolutely can. But you have to want to be able to stop that habit. Just like with anything else, you have to be able to acknowledge that you're doing the behavior, and you have to have the desire to want to stop the behavior, okay? So when we're talking about kids and thumb sucking, for example, most 4-year-olds are going to have a really hard time being able to say, yeah, I suck my thumb and it's embarrassing and I don't want to do it anymore and I'm ready to quit. A 4-year-old usually doesn't have that depth of acknowledgement yet to their habit and like what kind of social implications it's having. Older kids, 7, 8, 9, 10, they're embarrassed about this. They don't want their friends to know that they're sucking their thumb. They don't want to go to a sleepover at their friend's house, because what if the friend sees them sleeping with their finger in their mouth, right? So when you get a little bit older, a child understands that they don't want to have that social stigma. When you come to see me, I don't ever, ever, ever want you to feel like that, because there's no judgment here, ever. My job is to help you, all right? And there's a lot more people that do this than you realize, okay? So I don't ever, ever, ever want anyone to be embarrassed about this. But the point is that the child or the adult or the teenager or whoever it is has to be able to say, yes, I bite my nails excessively. Yes, I suck my thumb. Yes, I do this and I don't want to anymore. And I want to stop doing this. Can you help me? So if to just go back for a second, if a parent of a 4-year-old is saying, okay, I really want my 4-year-old to stop sucking their thumb, can you help us? Part of the answer is no, and part of that answer is maybe. Because we can't make the 4-year-old, if the 4-year-old's not ready and they don't understand, then it's not going to be successful. But we can do myofunctional related movements and proprioceptive training inside the mouth to try to help to guide the behavior to something different that's going to be more beneficial for helping that child's structure be supported and grow. A lot of people don't realize that as you are sucking your thumb, it begins as a necessity in utero, in the womb. The body has to prepare for sucking, to be able to feed after birth. So the thumb sucking is a normal physiological thing that should happen. But very quickly that should start to dissipate because now the mouth takes over, the tongue takes over, the sucking habit has been established and the child can feed. Okay. If that habit or that excessive pacifier use or whatever it is, or the thumb sucking continues for a long period of time, then the question starts to be raised by, a doctor or an airway dentist or another doctor, like, okay, is there an airway issue going on here? Because we know when that you put something in the mouth, it encourages the jaw to come forward. And when the jaw comes forward, then the airway opens and it's easier to breathe. Okay. So when it's an extended habit, it's like, all right, well, is this habit going on because of an airway issue? And then as it continues even longer and longer, it almost becomes a necessity. It becomes a person's coping mechanism. And it's projected that as you put that object in your mouth, you are stimulating your vagus nerve. And your vagus nerve starts on the roof of the mouth, and it's very, very highly responsible for the rest and digest and repair part of our nervous system. So a lot of times the thumb becomes almost like a self-soothing mechanism when a child gets stressed out or they get scared or they're very tired, okay? It becomes a soothing action. And what happens is not only is they're stimulating their vagus nerve. Let's just put it that way. When the thumb is touching the roof of the mouth, it's starting to stimulate the vagus nerve. And as the vagus nerve starts to activate, that helps with the self-regulation of that parasympathetic nervous system. So we can come out of that fight or flight, that nervousness, and start to relax a little bit, okay? I want the tongue to be able to do that instead of the thumb. And these are the things that we can work on with a 4-year-old or a 5-year-old to help them know, okay, where the tongue should go. If they can stimulate that nerve with their tongue instead of their thumb, then maybe those big spaces in between their teeth where it's open because they've been sucking on their thumb for so long, maybe those teeth, that space starts to close up a little bit. Okay. And maybe they get good sleep because they're still stimulating the vagus nerve, but without having to put the thumb or another object in the mouth to do so. I want your tongue to be able to do that. And then we work on other proprioceptive things. And there's a couple of little devices that we can implement and things like that. But we would talk about that on a case-by-case basis, okay? But also when I'm looking at your child, we have to make sure that there isn't, like I said in the beginning, we have to make sure that there isn't an airway reason that this is happening. So it's always a good idea to, whenever there's an extended habit, check with your doctor, check with your dentist. check with an ENT. You always want to make sure that there's not a structural problem, like, the bones in the nose are too big and they're blocking the air entering the nose. Or if the tonsils or the adenoids are really big and it's preventing air from getting into the nose. Okay. So we have to work with other people sometimes, other providers, to make sure that there isn't any physical obstruction anywhere. So really the goal with children is to help them learn through proprioception and through other activities, help them learn the correct rest posture, help them stimulate some of the muscles in their mouth and their face, help them to put their tongue in the right location, make sure that they can breathe well through their nose. And if there's things like snoring or, again, other airway suspicions as far as tonsils and adenoids, we want to work with other professionals to rule out things that are going to halt their progress. Okay. So, in a nutshell, that is how I plan my cases for kids. It's just like with an adult, it's very personalized. Every single person is so different. So a 4-year-old, there's a couple 4-year-olds I've come across that they could do every single thing I asked them to do, including holding their tongue up to the roof of their mouth and doing something that we call a suction hold or a cave hold. But then on the other side of it, I've had 10-year-olds that can't figure out how to do that. Okay. So it's so individualized. Every kiddo is so extremely different. So the way I recommend treatment for your child is going to be based on their unique abilities, their symptoms, your concerns for them. What are you noticing at home? Are they drooling? Are they drooling while they eat? Are they drooling while they sleep? Are they snoring? Are they sucking their thumbs? What's going on? And that's what we're going to base the plan around. So, in a nutshell, that's how I help children starting at age 4. I don't work with children under age 4. There's different things to take into consideration, and there are providers out there who specifically work with that age group. So I do recommend when those parents reach out to me and they ask about their baby or their 2-year-old, I do talk with them, and we can sometimes do some coaching and just some patient education. But actual myofunctional therapy would need to be performed by a provider who specializes in that 0 to about 4-year-old range, because there's other things that they're looking at that I don't treat. So, but yeah, if there's any questions about how that works, reach out to me. As always, we do a free discovery call. It's always free. You can visit our website and click on the free discovery call button, and then that will allow you to sign up for a time to hop on a Zoom meeting with me, and we can answer your questions, talk about your child's symptoms, and what you're hoping to get from myofunctional therapy. So as always, let me know if you have questions. Thanks very much.
Thank you for listening to Myofunctional Pathways, the podcast. As always, you can find us online at www.myofunctionalpathways.com. We're also on Facebook under Myofunctional Pathways. Instagram is myofunctional.pathways.llc. And you can also find us on TikTok and LinkedIn.